Dear friends, I am so happy to see you today, 19th July 2025. We have completed 1599 cases of Puberphonia. This is a great achievement by us. I hope Monday, 21st, we will get one more case. Thereby, we'll be celebrating that we are completing 1,600 cases of Puberphonia. This is beyond our imagination. So today is Saturday, 19th July 2025. We have completed 1,599 cases of Puberphonia. As usual, we got more than 99% success in treatment for Puberphonia. I am thinking the past days how we progress for such a huge success in Puberphonia. Whether my life is for Puberphonia or what more I can say. More than 40 years I am traveling with Puberphonia. When I was as assistant surgeon and a tutor in the ENT department of Stanley Medical College, unfortunate things happened that in the nearby railway track of Stanley Medical College, one college boy commits suicide because he was insulted by his colleague for his female voice. This is similar to ragging, that's all. Bullying by friends. That boy was desperate. Who am I? Am I a male or female? My look, my physical body structure, everything is he is a male. But the voice says it is childish or ladies are not matured. Ladies' maturity can be identified very easily, but gents' identity in voice mostly it happens at the adult age around 14 to 16th year. Voice mature from childhood voice to adult voice. Child and children and female continue to have a high pitched voice, but male it broke into a low pitched voice. What is the reason? They are telling many reasons. The larynx not developed, the length of the neck not happen, the vocal cord length not happen, it is not strong enough. No. All are matured in Puberphonia boys. They will have a normal neck, normal lengthy neck. They will have a correct Adam's apple. So there is no structural problem at all in Puberphonia. Larynx structure is completely normal. We have also noted phonatory gap. Vocal cords are lacy. Yes, all the phonatory apparatus is lacy in Puberphonia. There is no doubt. But The structure is completely normal. The vocal cord length is normal as a adult male. The structure is normal. The length of the neck is normal. Adam apple well formed. So there is no necessary for any treatment on the larynx. Why? But why the voice is female like? Why it is not mature? That is why we are contemplating a new theory for Puberphonia. Please try to understand. This may be new to the world, new to the ENT surgeon, but we are able to give lot of evidence in treating 1,599 cases of puberphonia. There is no structural deformity at all. There is no problem in the larynx. So, what is the problem? The problem is only in the pitch of the voice, not the anatomy of the boy. We are going on telling repeatedly for the last 39 years. We are going on telling that larynx is normal. Please concentrate on the airflow, not on the structure of the vocal tract or vocal cord. Still, you feel the voice should come from the vocal cord. How it is. Vocal cords are normal in structure in puberphonia. So that is why we divide the voice box into two: laryngeal voice box and pharyngeal voice box. Larynx is different, pharynx is different. Larynx is in the lower part of the neck, upper part of the neck, pharynx. Voice box, originally everybody accepted, I am also accepting. Voice box is larynx, which vocal cord vibrate. Yes, there is no controversy. But when voice break happen, laryngeal voice is converted into pharyngeal voice. Where voice is coming from? Many people will tell it is from the mouth, it is from the lips, it is from the nose, it is from the throat, it is from the larynx, it is from the lungs, it is from the lung, from the stomach. Yes, all structures are important, but we have given the names for the larynx as voice box. But secondary voice box is there, that is called pharynx. Pharynx also vibrate. The vibration of the larynx and pharynx are different. Larynx, the tissue is thin. Pharynx, the tissue are thin, thick, and the vibration is different. Here you are having vocal cord to vibrate. There you are having uvula to vibrate. Yes, uvula also vibrate. Uvula vibration means, do you think this vocal cord is not vibrating? All structures, abdomen, larynx, pharynx, nose, mouth, lip, everything acts. But the percentage of action is only different. If it is 50% action, see, all structures are there. The major portion is taken by larynx in case of children and female. But in adult male, the major portion is taken by pharynx. So in puberphonia, my observation, my presentation of the paper, my publication is laryngeal voice is converted into pharyngeal voice. High pitch voice is converted into low pitch voice. How? Yes, here what you want is not a structural change. The tissue which vibrate and make is high pitch and low pitch are different. Added to that, eula moves, vibrate like a vocal cord and moves like a tongue, and it only along with soft palate direct the airflow to the nose or mouth, because eula is a gatekeeper. Eula is a game changer. Try to understand. Eula is having a lot of function. It is a great game changer. So if you want to change a laryngeal voice to pharyngeal voice, eula play a major role. The majority of the action is by eula. Majority of the action is in the pharynx, which create high pitch voice into low pitch voice. Whatever surgery you do in the larynx and convert into low pitch voice means you are indirectly shifting the voice from larynx to pharynx. That is my observation. These observation I told to some of my friends. They accept it. Not only like that, you persist your idea, you do some research and prove that, yes, I am proving that laryngeal voice and pharyngeal voice are different. Yes, because when vocal cord become tired, you can convert your laryngeal voice to pharyngeal voice. Then your voice will become normal, resonate, and happily you can talk for hours without much problem. For that, what all the struggle I had experienced for the last 39 years, because this changing idea, changing concept is created in my mind from my school days onwards, my college days onwards, my assistant surgeon time onwards, tutor time onwards, assistant professor time onwards, civil surgeon time onwards. My concept is little out of box thinking that I can prove in so many instances. Why so? Yes, I had the opportunity. That's why, that's what I can say. God is very helpful to me in many, many occasions. Here I want to tell you what are the things happen. I was going on thinking, why not I do some more work? What happened to my younger days? What are the things I have done in my younger days? Why not you write? This is what the advice given my friend Mr. Julian. Contrary to that, he is also telling, he is writing his life biography. If somebody write your biography, definitely it will be little different. It cannot be a correct thing. If you write only, you will be able to give a correct answer for what you think and what is your ideas and what happened, what are the sufferings you got. So you will be able to tell. So I am going on thinking, why not I write what are the opportunities I had, how I am able to be a man of out of thinking for Puberphonia. It is, yes, it is purely out of box thinking for Puberphonia only. I am going on telling the Puberphonia number one. It is told only by aware in younger days. So, what are the different opinion? Yes, people may give lot of opinion, differ, using different words, different theories, but my opinion is completely different. Yes, that I have to think it more, and present to the society. So that is what I am thinking. So simply I thought, why not I write about what had happened in my life in younger days to the adult life. I was going on thinking in my mind how I started doing camp. What are the benefits of camps? I have conducted more than thousands of free medical camp. It is really surprising for me. We did free medical camp in different states of India. My favorite camps were in Kerala, Munnar. All these camps are not individually happen. I was molded to the camp. The primary molder is the great man, my teacher, Professor S. Kameswaran. He used to do a lot of camps. He has done camps in remote area, Thodas, in Nilagiri Hills. He had done it. Kanandevan Hills. He has done it. In Ooty Hills. He has done it because he was very much interested in doing camp, not only in not doing the camps. He has formulated few ideas. I was his favorite student who is doing DLO in Madurai. I was so fortunate, you have to think like that. We joined the service immediately after finishing MBBS. So, DLO, MSc, we continue as service candidate. service candidate means we work as assistant professor in ENT department and permitted to undergo the course DLO or MS. So we have little more authority in the department, not as PG student. We are paid assistant, but our responsibility is more. As a DLO student, as a MS ENT student, our duty is more. OP starts by 7 o'clock morning, early morning, but we have to be there even at 6:30 morning because we have to go around the wall and see the patients who are more for professors. Special ward, we have to visit and see what happened to them, and we have to present to the chief. Overall, when I was working in GH under Professor Satyanarayana, great man in ENT, we have to see him at the portico where he landed from his car, and we have to take him to all the wards, special wards, and tell him what had happened. This is a great experience for a junior for me 50 years back. He was a terror in the ENT department, but I was his paid assistant by the government of Tamil Nadu. So such a great responsibility is there, because why I am saying paid assistant and honorary assistant. Similarly, 2 honorary assistants also will be there in each department. But you know that honorary assistant, they do got good job, no doubt, but their responsibility is less. Responsibility is mean this mean definitely in a day you will get more than 5 memos. Memos means referral from other parents department, surgery department, medicine department, skin department, referred to you. All these should be seen by the ENT doctor, paid. And the costly drugs, we have to only sign it. I am not telling they are not prevented. The honorary doctors are not prevented. But we have to take the responsibility of that and attendance. When the boss goes for taking class, I should go there little 10 to 15 minutes earlier. Be there, prepare the board and everything, chalk piece and everything. And as soon as 2 o'clock, the chief will come and for taking class, I should stand there and take attendance. And above all, after finishing the attendance, we should see and sit in the last row until the class is over. We have to be there. But a man like Dr. Kumaresan sitting in the last row means no students will prepare to make any galata in the class also. So such a responsibility was there when I was working as an assistant professor of ENT or a paid assistant in General Hospital under Professor Dr. Satyanarayana, Professor Kumaresan, and lastly, Professor K.K. Ramalingam. Yes, because Professor Cherian was the first ENT surgeon, I know that. Yes, it is there. He only formed the first president for the ENT Association of India. That time, Professor C. Satyanarayana had taken me along with me to Mumbai for ENT conference, and that time we have registered as permanent members of the ENT Association of India. I am a little boy, but working in GH under state government. You know my registration number? It is 39. 39 All India. All India ENT surgeon. 1, 2, 3, 4, 5. If you count, my number is 39. I am the 39th ENT surgeon in all India level in Association of ENT Surgeon. Nobody can imagine. Still, I am able to say proud. If somebody asks me the number, if I say 39, they will be astonished because that rank fellows, doctors, mostly no more available. So these gifts are there for me because of my seniors. So I had the privilege of doing lot of research. It starts with a new approach to the middle ear, rhinospondiosis, independent research we did with bacteriology department. A new approach to the middle ear I presented in Singapore. It was published in the Indian Journal of Otorhinolaryngology. I got the EMERC award, a national award. EMERC award previous to me, Desmond from Bangalore, from Vellore got it, Dr. Desmond. I'm the second ENT surgeon. After that, no ENT surgeon also got in Tamil Nadu. Yes, all over India they are giving. So I had a lot of privilege to be a researcher in ENT. So what more I want? I want, yes, until my long days, I want to do more research on Puberphonia. That is my life. Happy to tell you that this Saturday, 19th July 2025, we have completed 1,599 cases of Puberphonia. Happy, happy, happy. We'll meet next Saturday, same time. Thank you very much for your nice listening and travel with me. Happy, happy, happy. Gayatri, boy, boy, Gayatri, Arjunma. அதை பிரிண்ட் அவுட் எடுக்க சொல்லிட்டாருமா அந்த லெட்டரை
எடுத்துட்டு
அதான் என்ன எழுத சொல்லியிருக்காரு. வாங்க, எனக்கு 2 காப்பி எடுத்து கொடுத்துருங்க. லெட்டர் பேட்ல வேணும்.
அது ஆல்ரெடி லெட்டர் பேட்ல தான் இருக்கு.
ரைட், ஒரே ஒரு இது மட்டும் எடுத்து கொடுங்க. To whomsoever it happened, to whomsoever it may be.